My name is Connie Girgenti, and I'm a registered nurse in the United States, and I was a NICU nurse for 13 years. We weren't trained. We had a short introduction to the NICU, and I can remember walking in Children's Memorial and seeing the isolette and opening that little cover and thinking I could never care for such tiny patients. I think, being that mom, it got very emotional because that was my first introduction to the NICU, but no formal training. There is. Typically, we want to give mommy the baby right away, but in prematurity, very often they're taken right away, sometimes resuscitated, often all the time stabilized and put up on the heart monitors and things. So they are immediately taken away from their mother and then taken to the, put in the isolette into the NICU. Oh, it varies so much. If there's babies at home, sometimes moms can't stay. Often there's a long drive or mom can't drive. And even in some cases, the moms in the ICU can't come. So it can vary from a few hours a week or a few hours a day, or sometimes all day. Moms will move mountains to be with their babies. It is so important. We can't forget that these little ones hear their mother's voices and their father's voices, as they're growing. And the role then becomes a comforter, a soother. Moms can contain their babies while the nurse does cares. They do kangaroo care. And while they're doing kangaroo care, their oxygenation stabilizes, their heart rate stabilizes. And not only does it help that little baby feel connected to their mom again, but it helps mothers and dads. Dads also do kangaroo care, but it really helps them, everybody bond in the care of the patient. It is cliche or easy as it sounds, it's to breathe, right? They're kind of thrown into this environment that is incredibly stressful. I also think it's important that they trust their healthcare team, their NICU team, and ask all the questions that they need. If you don't, you have to have trust in that team. I've been there as a nurse, so it's hard to offer that advice from a parent. I think one parent can give another parent far better advice, but trusting the healthcare team is important so they can leave and have some rest at night. Yeah, unfortunately, I don't. Very often, parents learn about it either most likely through experience, being there themselves, or having a sister who's been there, or a best friend who's been there. It's programs like this World Prematurity Day and fundraising activities that you'll hear about in a little bit that help bring about awareness to the community as a whole.